The next speaker who will speak on technology is Elena Bonfiglioli. She's the head of health and life sciences for Microsoft in Europe, Middle East, and Africa. Elena is responsible to drive strategy and business development for public health and pharma, working together with a community of over 150 professionals across the region. Elena spearheaded key initiatives on Health 4.0 and health digital transformation. Mobilizing a core group of industry stakeholders, Elena started the European Cloud in Health Advisory Council, a vendor-neutral C-level forum aimed to foster cloud-first innovation in the health sector. Elena started at Microsoft in 2003 as Director of Corporate Affairs and Corporate Responsibility. She is the co-founder and board member of the Women in Leadership Network, a joint effort between Microsoft INSEAD and the Women's Forum. Elena?
Thank you very much. It's a real pleasure to be here. I hope you can hear me well and see the screen well. Just give me a thumbs up, hopefully. I come to this topic with a health policy and economics background. So definitely there is nothing more interesting than looking at what does it take really in an holistic way to look at healthier longevity. And longevity has been, I would say, an age-old quest. And it is interesting to see that physical longevity today, given current medical and scientific assumptions, is pegged somewhere between 125, 150 years old. And so considering that we are already raging towards that theoretical maximum, what is the opportunity that is at hand and what is the real need from a technology leadership standpoint? And this is where we ask ourselves, really, where can Microsoft uniquely help? So if our technology expertise would go away tomorrow, what would not be really, I would say, addressed? And I'm sorry, I just have an issue here. Yes, I wanted to move out the little bar. So with that question in mind, we really zoom in on empowering quality of life. That is what drives us across three lenses, and across these three lenses, I would like to share the contribution of where technology, cloud, artificial intelligence can really take the empowerment of quality of life. First of all, the ability to empower every one of us as person or patient to achieve those productive, healthy life, given the years that we have to live. But also, at the same time, empowering clinicians with new tools that support that healthy longevity while we are facing an unprecedented situation. The gap between demand and supply of care has never been so sharp. WHO recently predicted 18 million health workers shortage in the next decade. There is a 13 million foreseen gap in terms of the availability of physicians. There is analysis that looks at 76% of nurses and 73% of physicians being busy with tasks for which they are overqualified. And at the same time, there is this really strong need for care with people that simply do not have access to the care that they need. At the crossroad of that demand and supply is really the ability to put novel tools, novel solutions that liberate the productivity of the clinicians and enhance the opportunity for patients, but also the opportunity for researchers. So if we take these three lenses, what I wanted to fast forward on is, what are these tools? So let's take a moment and think about conversational AI, chatbots. They have been really catapulted to the front floor of any experience for citizens that were worried with COVID. Our healthcare bot has been used with 2 billion messages. At the peak, 760 messages per second. So when you think about stretched health systems, definitely these type of tools can bring scale. And if we think about the user, the elderly user, it's not only about typing, but more and more also, how do you enable voice command or video consultations? And then when you think about how you really save time in oncology treatment, radiotherapy, with automatic segmentation of medical images, we really see novel solutions powered by AI and object recognition that are coming to help clinicians. On the right side, and just following some of the scientific insights that Thomas shared, how do we use AI not to translate from English to Italian or to Mandarin, but really to translate the language of the T cells to the language of antigens and spot the early onset of conditions and make sure that we come to early diagnosis, early medication, and healthier lives. And then finally, also, when we think about an aging society, predicting vision impairment, predicting the onset of diabetic retinopathy, making sure that we have the right prediction for age-related macular degeneration. So all of those things, as well as accessibility solutions that make those that are visually impaired see the world around themselves, are really powerful opportunities. And here I wanted to give you a taste of how these cognitive services, so very far from us, right, are getting applied into the clinical space, sometimes the surgery room, sometimes the living room. So there's a new family called ambient clinical intelligence, which really redesigned the patient-physician encounter. You see the doctor, you see the patient there on the left side, and all around you see basically an artificial intelligence, consent-enabled type of solution that tracks the conversation between the patient and the doctor, that basically structures it in text, that is queryable, that is structured, that is integrated with the electronic medical record, and that leaves the patient in control. But what is most interesting is that 9-minute decrease in average waiting time for primary care. So 24% more cases in cardiology being seen. 76% of the people that are using it across all ages, including the experience of the doctor, say that it improves patient experience. Now, if we go from the doctor room to the living room, this is where before, for those that were in the earlier session, I referenced the example from Finland. Diagnose and treatment are brought to the living room through the health village, an experimental work that has been now scaled up across Helsinki and Uusimaa hospital in Finland. Digitization of over 40 pathway, opportunity to choose if I go for a physical pathway or for a digital pathway, automation of the remote monitoring ongoing for the patient in the living room, with automation in the background of appointment scheduling, and all of this based on standardization of data ingestion. Without the standardization, we will not be able to have anything else than a mosaic of point solutions. And then from the living room, we can move to the operating room. Virtual reality, so the superposition of holograms onto the reality that we have in front of us as doctors has enabled a real democratization for treatment of specific conditions at distance. We had here a quote from a French surgeon saying, all of a sudden, as I was doing an HoloLens enabled shoulder replacement in the operating room, I had a French perspective, I had the best specialists from the US and Latin America. Everybody seeing what I was seeing, they were remote, as if they were in the room. That is transformational, because the way you change what the surgeons see, you can also change the preparation of those treatments, you can change the training for medical students, and you can democratize access to health expertise, particularly for low and medium income countries. And similarly, you can have those visual data rendered around the patient with vital signs that are visually enabled. And then this is the delivery of care. But when we think about the precision health and AI enabled opportunity, we see a couple of things. First of all, precision health really is hinging on the availability of data. If we can transform the world from analog to digital, then we can query. But those digital input needs to be standardized, needs to be open, needs to be shared, needs to be governed. So before we spoke about data collaborative, I wanted to bring the case of the Alzheimer's Disease Data Initiative. And I know that representatives from AARP and others are here. Congratulations to all of you for coming together and really making sure that there is a trusted data sharing environment that enables collaborative data scientists. We are very honored that our cloud solution powers those type of collaboration and also those type of data discovery following fair data sharing principle. So there is a real new culture of data collaboration for the common good. And here I must say, followed by the idea, guided by the idea of data dignity. So extracting utility from data, not for commercial advertising purposes, but really to advance research or treat for better outcomes. And as I go towards the closure, I wanted to also bring two more aspects. First of all, when we think about how do we accelerate research, we also have to think about new areas. I mentioned that with artificial intelligence capabilities, we're able to decode the response of the adaptive immune system to improve the diagnosis of disease, really from a blood draw to really understand the early onset of some conditions. And Microsoft has partnered now for a couple of years with Adaptive Biotechnologies in this work. And there have been really early signals of how this applies to a couple of conditions, amongst which, for example, Lyme disease and others. And so this translation ability is really quite unique and very promising for the type of regenerative and predictive type of medicine that we want to see in the world. And because oncology is really definitely affecting, and tumors are, cancer is really affecting with strong incidence, those above 65 years old, I wanted to bring to the forefront a new tool that has been developed with the Jackson Lab in Maine to look at how AI enables precision oncology and the ability to extract knowledge from the thousands of PubMed articles and then look at correlations, specific correlation that pertain to a specific cancer. So I hope that the video is rolling well for everyone. But what you're going to see here is really the opportunity to look at a very wide database of human annotated papers, to condense those and to bring them into a searchable tool, queryable tools that oncologists that can really use to make sure that they ask the specific questions that pertain to the patient that you're looking at, and they can have access to a much, much wider body of knowledge that was ever possible. So this is really about democratizing access to knowledge for scientific advantages. And then there would be, I would say, no possibility to really think about healthy longevity without thinking about access and equity. And I thought that this chart was really important in terms of the correlation of where people are living a higher proportion of their years in good health. And Michelle started at the beginning with user-centric design and accessibility. And so I thought it was good to share the fact that we really have an imperative of assistive technologies empowering the 1 billion people that have some form of disability by birth or acquired disability, temporary or permanent. And we know that that is more prevalent also as we age. So visual impairment, AI capabilities that allow us to understand the world around us, to narrate. If I could see if you're nodding when I'm presenting, or if you're just simply distracted, or simply, you know, what is the object around me? What's the color? Imagine a voice that narrates all of this for visually impaired people. That is fantastic. And all of that needs to be driven and guided by inclusive AI. So important principle for how we design artificial intelligence. And for that, you know, I think it's really about not only healthy longevity, but healthy longevity for everyone, starting from each patient, each doctor, and each researchers, but for every one of us. Thank you very much. And I've learned a lot today, so I'm really grateful to be able to be here with my colleague, Chief Medical Officer, Dr. Ru, who has been participating in the session before. Thank you.